Anatomy 32, Chapter 23, the respiratory system, topics, pharynx and larynx. So, as mentioned in the previous lecture, air will leave the nasal cavity through the internal nares and enter the pharynx. So the pharynx, or back of the throat as it were, goes from the internal nares to just above the esophagus and larynx. The first portion of the pharynx is called the nasopharynx. It comes directly after the nasal cavity, and it goes from the internal nares to the soft palate. Within the nasopharynx, you have the openings for the auditory tubes. These are the tubes coming from the middle ear, as well as the pharyngeal tonsil is located in the nasopharynx. The next region is the oropharynx. The oropharynx goes from the soft palate down to the hyoid bone. The oropharynx includes the opening for the oral cavity, and you can find the palatine tonsils and the lingual tonsils as part of the oropharynx. And the third region is the laryngopharynx. Laryngopharynx goes from the hyoid bone to the esophagus and larynx. Again, from the hyoid bone to the esophagus and larynx. Those are the three regions of the pharynx: nasopharynx, oropharynx, and laryngopharynx. The pharynx functions is to conduct air between the nasal cavity and the larynx. So carrying air when you breathe in to the larynx and when you breathe out to the nasal cavity. Next up is the larynx. The larynx is anterior to the esophagus and obviously inferior to the laryngopharynx. And the larynx's job includes conducting air between the pharynx and the trachea, and also to produce sounds, including sounds we make for speech. So here is images of the model for the larynx as well as an actual larynx. And the larynx, it turns out, is composed of 9 different cartilages. First cartilage is this leaf-shaped cartilage, a superior cartilage of the larynx, and it is called the epiglottis. And the epiglottis will fold down and cover the opening to the larynx when we are swallowing. So this epiglottis will fold down, cover the top of the larynx, propelling food to the esophagus rather than going into the larynx, which would be bad. The hyoid bone is also an important structure for the larynx because much of the larynx is connected to it. All right, then we have the thyroid cartilage, cartilage number 2. Thyroid cartilage points out anteriorly. It is the largest cartilage of the larynx. It is attached to the hyoid bone via the thyrohyoid membrane. And it is very important structurally for the larynx. And the thyroid cartilage is often referred to as the Adam's apple and is more prominent in men than in women. Cricoid cartilage. Cricoid cartilage is the inferior cartilage of the larynx. Cricoid cartilage connects to the trachea via the cricotracheal ligament, and it connects to the thyroid cartilage via the cricothyroid ligament. On the posterior side of the larynx, it's possible to see the 2 arytenoid cartilages. These are triangular-shaped cartilages. The arytenoid cartilages are movable and help to support the vocal folds, and so important in speech. There is the superior to the arytenoid cartilages are the 2 small corniculate cartilages, two small little sort of horn-shaped cartilages, and they are also movable and important for speech. And then the last two cartilages are the cuneiform cartilages. They are a bit more on the lateral walls of the larynx, and they help to provide structural support for the vocal folds. And so those are the 9 cartilages that make up the larynx: the epiglottis, the thyroid cartilage, the cricoid cartilage, the arytenoid cartilage, the corniculate cartilage, and the cuneiform cartilage. On the lateral walls of the esophagus are 2 folds. There's the superior vestibular fold. The vestibular fold does not produce sound, but it can open and close, limiting or allowing air to flow through the larynx. Inferior to that is the vocal fold, sometimes called the true vocal cord. The vocal fold is what vibrates to produce sound. So the vocal fold is what produces sound. So the space between the right and left vocal folds is called the glottis. So it is the passageway that goes through the larynx. And of course, the larynx is always open with air in it. And as you can see, the vocal folds are a little more prominent than the vestibular folds, but the vestibular folds are able to close and open the larynx. So the vestibular folds can come together in the middle of the larynx, preventing air from being able to flow through it. All right, when air passes through the larynx, it causes the vocal folds to vibrate. And it's that vibration that produces the sound. So when the tension on the folds is increased or decreased via muscular contractions, that can vary the pitch, making the sound higher or lower. So when tension is increased, that will lead to a higher pitch. When the tension is decreased, it'll lead to a lower pitch. And then the amount of air that passes through the larynx determines the volume of the sound. More air passing through, increased or greater volume of the sound. That is it for this part of Chapter 23.